Washoe County getting ready to start testing for antibodies. This test will determine if someone has had the virus in the past. Now, the test from Abbott is considered to be highly accurate. It is one of about a dozen to get an emergency use authorization from the FDA. Company's data shows out of 1,000 samples, only 4 were false positives. Paul Nelson has more on this. Have a look.
The Nevada State Public Health Laboratory is finished with a validation study. The results show that the Abbott antibody test works very well.
People that had previously tested positive actually were detectable as having antibody, and people that had previously tested negative by the swab test tested negative for antibody.
The blood test could show if someone was infected with COVID-19 in the past, possibly as far back as January or earlier.
Rarely is it that you get the ability to travel back in time. Rarely, never. But in fact, here with an antibody test, you kind of have that ability.
Washoe County is working with the University of Nevada to conduct the tests. The plan is to select people randomly starting in June.
If you wanted to look at the population at large, that's best done by doing a random sampling.
Many people think they may have had COVID-19 but didn't get tested. That's not who the health district is looking for.
In medical science and in public health science, curiosity is not a great reason to get a lab test. It's a medical resource, and in a time like this, medical resources are precious.
Pandori says narrowing the test to people at high risk could also provide valuable information, like medical workers.
There was a lot of risk. What really happened to your population? How many of you really were infected and you didn't know it? Or maybe you just felt a little run down one day.
And there's a lot of questions of how the antibodies affect immunity.
Maybe there would be confidence about certain people going back to work because we knew that they were immune. It's maybe upsetting to the community still, but we just don't know that yet.
Covering the story, Paul Nelson, 2 News.
Now this one, the coronavirus we're experiencing now, is one of many different coronaviruses, including the common cold. And immunity doesn't last very long with some of these viruses, so we still have a lot to learn about how this pandemic will shake out in the future.
Yeah, we sure